Thank you so much. Our next speaker is Dr. Alexander Angelov. He is the founder of the Clinic of True Healing MD of Internal Medicine in Boston, Massachusetts, in the United States. His presentation is entitled Integral Medicine in the Era of Global Pandemics. Thank you so much, Dr. Angelov.
Thank you very much. I hope you hear me well. Um, Such a pleasure. First of all, I want to say that translator can relax now. After talking at Ernst is like the second cup of coffee in the morning because we have morning today. And it's like you try to drink this cup of coffee and you find out that it's champagne, bubbling champagne, really great one. So I understand that it's a long day, so I'll start with a joke. The God get the news to the nations, and he get all representative from all confessions, and said that in 7 days we'll have flooding, so the earth will be under the water. And so the priest and imam came to their people and say that, guys, you know what? We restricted you so much for all these years. You have 7 days, enjoy it. Whatever you were restricting from, you just enjoy it. And the Jewish nation was waiting and waiting and waiting for 2 days. And then in 2 days, the rabbi came and says that, guys, we have 5 days to learn how to live under the water. So welcome to coronavirus era. And we have to learn how to live under the water. Let me start the, okay, to do. I hope that you see the presentation and we can start. Okay, great. So we are in the era of coronavirus, and all of a sudden we realize that the medical system crushed. Why? What happened? And we all of a sudden realize that it's not joke, it's not media. We understand that a lot of people get hurt, and it's really pandemic because it takes the whole world on one side. It doesn't really measure the the wealth of the person or the place where this person lives. It's really global problem. And we're scared. Of course we're scared. And all of a sudden we realize that the medical world is frustrated because we don't have the answer to that. We start to understand how can we fight with this pandemic, with this virus. We're trying to create the vaccine, we try to create the treatment, and yet we don't know the answer. And at the same time, we have like real-time experiments. And it doesn't go just into the lab, it goes into the nation. In the myth of the plateau of this virus, we created the parade, you know, in Belarus. All of a sudden, the president of the Belarus says that this coronavirus is nothing. So let's get together, especially with the people who get through the World War II, elderly people. We can get together. The coronavirus doesn't exist. It's just the myth. And let's prove that we're right. So we don't know the result because it was yesterday. We'll have to see. But let's see what the medicine is all about before coronavirus. We know that the medicine in the pre-coronavirus era was basically not the medicine, but medical business. And medical business based everything on the outcome, how much money I can make on this business. And the business was oriented on the disease. How do we treat this disease? Everything is around disease. How we catch this disease in the early stage. How many colonoscopies and blood pressure measures and mammography and everything we can do to catch disease in the early stage. And of course, we have so many pharmaceutical companies that can produce the pills to fix the problem. And around everything, we are not talking about the person, we're not talking about the sick problems, but we're thinking about the distribution of wealth. And of course, in this party, everybody's welcome. So we have a big pie. Let's go. Let's make a party. And instead of saying that it's health care system, I call it health don't care system, which is like better representative of what is going on. And we have the pyramid that Professor Krasnov was talking about, the pyramid. And here we have a different type of pyramid, where at the top of the pyramid, we have the sick person, and a lot of company is profiting from it. And the end consumer has to live a very long life, but being very, very sick. That's very profitable for the system. We pay money, whether it will be a person who puts money on the table, or it will be company that puts money on the table, or maybe the government. But we have money, and then we have a fight. Who will get the better piece of this money? Really, the question is, did we like the system? Did we like the healthcare system before coronavirus? Are we getting to the dead end? Yes, we get to the dead end. Let's get a little bit back in the history. What did we have before? We had a healer or person who wants to provide the services, and we have the person who needs this healing. And then between this person and the person who wants to get better, we have something very simple. You know, let me give you the bunch of the vegetables, or let me rub your back, or whatever you need in your life, let me compensate on your work. But it's not enough. Now there's two entities, the person who needs the help and person who can provide the help, get apart. And between them, we have whole system of liches that try to get everything out of this business. And we really didn't like this. The people who wants to get it try to protest, but they cannot do anything about changing the world. And tell you the truth, all these years I'm in a medical world, I never thought that I'll be witnesses the crush of the healthcare system. Never. But now it's reality. So the people who receive the care are not happy. And what is establishment, medical establishment? They don't really care. They don't really know what to do anymore. And here's the coronavirus came. It's a big surprise. It's a coronavirus. Nobody knows what it is. The medical society call it COVID-19. Great name, but what do we do? We have no idea. Where's the science? Where's the everything? We should be prepared for all these years, and we are like catch with a surprise. I catch myself that I get into the speed of Ernst. I'll slow down. Sorry. So the new phenomena that we have today in medicine it's very upsetting. Is the the person bring their mother or father in the hospital, and because of the disruption, it's the last time that this person will see the father or mother, and no connection, no understanding what is going on beyond the door of the hospital, because everything is closed. And we do a lot of actions. We were fighting for the ventilators, and we're trying to get these ventilators from different companies and everything else without understanding of what's the reality of this disease, what's the cause of this disease, and how we can help with this disease. The statistic is back a little bit, and it's shocking statistic that only 14% of the people who get on the ventilator survived. 14%. Out of this 14%, 50%, meaning 7%, get damaged organs, and we have no understanding what to do. And we don't have any treatments. Sad story. But at the same talking, the other part of the medicine is kind of vanished, meaning that outpatient clinics are closed. Oops. So we cannot see patients in the outpatient clinics, and people don't want to go to emergency room because they want to be safe, and their family wants to be safe. They don't want to go to the mini clinics to have the same effect. And so we don't have
Yes.
physical therapy. The chiropractic offices are closed. The acupuncturists are closed. Everything is closed. So what do? Where's our medicine? It's vanished. So we have the acute response in the hospitals where people work overtime, and we have dead space for the real approach of the regular disease and problems. Yet we want to be in the cross section of the happy and healthy. Let's look about the evidence-based medicine that we had before coronavirus. We had exchange between the people who provide healthcare and people who needs this healthcare. And we have, of course, the organizations that controls everything. So when we have any kind of results, we go to the research companies, and these research companies have specific rules, and it all depends on the government rules and different organizations in the government. And after everything is done and we filter the results, we get to the public whatever government wants, whatever the scientist can profit from. The huge phenomena that arrives right now, that people in different countries ignore government. They start to connect face to face, heart to heart. People in Italy were crying out, saying that people, we get the hit, you're next, you'll be the next. Learn from us. Ventilators don't work. Medicine don't work. So the best way to protect everything is educate people how to prevent it instead of reacting after everything is happening. So please, and they start to connect on the level of human being. So the network that exists in the humanity, in the all pyramid of the connections, start to emerge, and people start to share information regardless of the protection of the government. The people start to get in community, and it's very unfortunate fact that people who don't have a good social economic level, they live in 3 rooms, like 20 people, and their way to spread the infection is higher. And what do we do with these people? How do we prevent it? How do we get to the point that they don't have to go to emergency room and be in a hospital? People don't get anything from government, so they have to create their community on its own. So it's another level of connection. These physicians start to create online database of how to prevent and how to treat and how to communicate. And of course, scientists get in the next level. Interesting thing that it's vaccinations, not vaccinations, people who are for vaccinations and people who are against vaccinations. And we have scientists in the closet that have their opinion, but they cannot express this opinion because of the restrictions in government and everything else. And now with the new way of communication through internet, they start to talk. They are saying to the world is that you're waiting for the cure of this disease with the vaccination. Think again. We have disconnected community. We have disconnected world. And if we connect it in the right way, the coronavirus will not be there. So, but instead of this, we're trying to make something that from scientific point of view doesn't make any sense. The virus is the memory, is the part of the RNA in the little envelope, and it doesn't survive by itself. It's like parasite. It needs the host, and the host is the human being at the present moment. If we don't get the spread from host to host, so this virus doesn't exist on its own. So let's respect each other. Let's make our world better world and understand how can we live together in a harmony, and don't let this carrier to go from one person to another person and infect the world and give a lot of troubles. So we have to get to the next paradigm of how can we live life under the water in a new environment. We're not going back. We will never go back. We're moving forward. We're moving forward with our understanding of how can we collaborate, not to fight each other, but collaborate much better. So the evidence-based medicine in the future is this. We have interaction between the patient and the physician. And we have community that gets all this information, bypassing the government filters. And then we go back and forth and we understand what helps, what doesn't help. You go to conventional physician, great. You resolve your problems, you have the solution, you spread this solution through the world and we'll be fine. We can implement it right away. If you didn't have help from the primary care physician, you go to the specialist. You get your answer, you spread it to the world. You have your failure. You said that I had a failure. Let's move forward as the humanity in a better way. And then you can go to alternative sources like Ayurveda, which is only 3,500 years, and the traditional Chinese medicine, 3,000 years, compared to this monster medicine, which is 250 years. Who is alternative? And then we get it to the public. And with all of this, we can create the solution. And the solution has to be equally good for people who provide health and people who receive health. That's the medicine of the future. That's the solution. That's where we will be in a much better place in a cross-section of the health and happiness. And thank you very much.
Thank you so much, Dr. Angelov. Would it be possible for you to unshare? Yes, thank you. We do have one question. Let's see if I can find it now. Here it is. How can we change in ourselves and in the world to change the outcome?
It's very difficult, but it's very simple at the same time. The difficulties is that we attach to the previous paradigm where we have to win, where we have to elbow everyone out, where we have to compete, where we have to be on the top of the pyramid. That's the paradigm that we came from before coronavirus. And now we are in a reset set, meaning that the hardware is good. You know, we have everything that plays as the hardware. We have hospitals, we have outpatients clinic, we have diagnostics, we have everything. But the software stinks. I'm sorry. So now what we need to do, we need to change the software because the hardware It's just hardware. And we try to make differences, but we can't. So here the coronavirus came and said that, guys, you're at the dead end. Let me reset your computer. Boom, reset. Everybody home. We don't have now unnecessary things in medicine, meaning that all planned uh, diagnostics and treatment are suspended. And so only emergency medicine is on the surface right now. So then we start to get our computer up and up and say, okay, do we have problem with the disease? Do we have problem with the lack of the treatment? Or we have problem with our relationships? Relationships. Let's work on it. And it's not that we'll be waiting until government will get us the solution. It's our role. The Ivry Institute is the great solution, multiplying to whatever we can offer to get to the core of the problem, to let people understand that the problem is not the virus, the problem is not the government, the problem is our corrupted relationships. Once we fix our relationships, we'll be healthy, we'll be happy. We don't need this medicine. We need new medicine where we'll be educated how to eat, how to move, how to breathe, what the best water to drink, or what the best tea to drink. So we're in a great path.
Thank you so much. We'll take one last question. This one's from YouTube. Is the coronavirus man-made?
I have two questions. I mean, two answers. The one answer, I don't know, and nobody knows, by the way. And the second one, I don't care. Because even if it's man-made, it's made by nature. Somebody screwed the mind of the person who make it happen, but it's nature. So on the top of the pyramid is the nature who is ruling everything, get to the point to understand for the humanity that we are in the wrong path. And so I don't care about how it happened. I care about what's the outcome. We can get out of this coronavirus as one nation without borders. We can come from this coronavirus as the conglomerate of the patients and the physicians. We can come out of this coronavirus as the respected each other humanity. And we will succeed.
Thank you so much, Dr. Angelov. That was wonderful.